Okay. Good morning, everybody, and thank you for checking out my video presentation on nerve blocks in the urgent care. And the purpose of this video presentation is hopefully by the end of this lecture, nerve blocks will be a little bit easier to perform in the urgent care and also hopefully more fun. So I'm going to go ahead and start from top to bottom. I will do facial blocks. I will do ear blocks, dental blocks, and then also different methods of digital blocks. Our first nerve block that I'm going to be talking about is the supraorbital nerve block. And I want you guys to go ahead and try to feel your supraorbital notch. When the patient is looking straight ahead, it is in line with the patient's pupil, and the notch is right here. If you're feeling it on yourself, if you're feeling it on somebody else, just try not to poke their eye out. Just kidding. So in terms of this nerve block, the technique of the nerve block is when you inject the needle is injected perpendicular at the immediate superior aspect of the notch. So the notch is right here, immediately superior to the notch. You are going to go ahead and inject perpendicularly. Never inject into the notch itself. So when you also inject, you are going to use your non-dominant hand, and you are going to press firmly on the orbital rim. And the reason for that is you don't want the anesthetic to pull down into the eyelid and cause swelling of the upper eyelid. So we'll take a look at this picture. The needle is perpendicular right above the supraorbital notch, and you are going to use your non-dominant hand to press firmly on the orbital rim so the anesthetic doesn't pull down and cause swelling of the upper eyelid. Okay, so this is the area that if you do successfully block the supraorbital nerve, this is the area that will go numb. So it's useful for lacerations of the eyebrow, forehead. There is another technique. It's a field block. Let's say you did a supraorbital nerve block and you did not achieve anesthesia. There's another technique, and it's a lateral approach. So your needle is going to be parallel to the orbital rim, and you're going subcutaneously injecting from lateral to medial. And when you do that, that will result in a field block. That's because it blocks all the branches of the ophthalmic nerve. And same thing, you put your non-dominant finger just so the anesthetic doesn't pull down to the eyelid. When I do my nerve blocks, just a rule of thumb for most of the blocks, I choose lidocaine with epinephrine 1%. I try to stay away from 2% because you can reach lidocaine toxicity a lot faster with 2%. The needle I never use a needle smaller than a 27 gauge. And you use like an inch long needle. You never need to inject more than 2 to 3 milliliters in one area at a time. And in terms of if I'm doing a dental block, then I would go ahead and use mixture of lidocaine with Marcaine or bupivacaine because it will result in about 6 to 8 hours of pain relief, and that's the whole point of doing dental block, is to give longer pain relief. Okay, the next block we have, it's the infraorbital nerve block. Okay, again, I want you to go ahead and try to feel the infraorbital foramen. It's like a little tender spot right here. And when the patient is looking forward, it's the exact same line with the pupil. So right under that pupil, that's where the infraorbital foramen is. So how am I going to block that nerve? Go ahead and lift your upper lip up, and you will inject into the buccal fold right above the premolar tooth, or the second bicuspid, right here. You'll inject right here. The needle will be directed toward the infraorbital foramen. Patient looking forward. It's on the same line with the pupil. Like this picture right here. That's the direction of the needle upward toward the infraorbital foramen. If you have a successful infraorbital block, you will be able to numb the upper lip, cheek, and the area below the eye. So it's helpful for upper lip lacerations, cheek lacerations, or lacerations below the eye. So this would be a perfect example for why you would want to do an infraorbital nerve block. This kid has a laceration of the upper lip, and you really don't want to distort the anatomy. So that would be a perfect infraorbital nerve block. Okay, now we're going to do mental blocks. So with the mental block, you are going to go ahead and pull your lower lip like this, and the needle is going to go along the lower gum line in the buccal fold between the premolar teeth. This is the mental foramen. You're not going to inject into the foramen itself, just that buccal fold between the premolar teeth. And that's really useful for lower lip lacerations, like this picture right here, that is involving the vermilion border. So you would go ahead and do a mental block on this patient. If the laceration is in the middle, then you're going to have to do mental block on both sides to get the middle part. There's cross innervation, so one side won't be enough. Okay, so we did the facial blocks. Now we're going to do the ear anesthesia, or the ear block. And the most common reason why you would want to do an auricular field block in the urgent care is if you have back of the earring stuck in the ear, or if there is an ear laceration. So in order to do the ear block, the needle is inserted subcutaneously just inferior to the earlobe attachment with your head. And you are going to advance the needle just in front of the tragus. As with any kind of injection, you have to aspirate, make sure you're not getting any blood. You are going to inject while withdrawing the needle. 2 to 3 ml is sufficient in any nerve block. You're going to withdraw the needle. Don't pull the needle all the way out. Reposition the needle, and you're going to go behind the ear without removing the needle along the inferior posterior auricular sulcus. and you're going to do the exact same technique. That will numb your lower half of the ear. If you need to numb the upper half of the ear, so exact same technique you'll do on the superior aspect. One will be in the front of the tragus, and the other one will be crisscrossed right behind your ear. And please don't inject into the cartilage itself, just subcutaneous. Okay, I'm going to be talking about only 2 dental blocks in this video presentation. The posterior superior alveolar nerve block. And the reason is to achieve anesthesia to the upper molars. As you see in this picture, the molars that are in red, this is the area that will go numb if you have a successful posterior superior alveolar nerve block. And in order to perform this nerve block, lift your upper lip up, insert at the buccal margin of your second molar. So find your second molar, and right above the second molar, go into that buccal margin. The needle direction is toward the maxillary tuberosity. You inject upward, backward, and inward. Up, back, inward, about an inch, and that will produce a posterior superior alveolar nerve block. Like I said, I will usually use Marcaine or Bupivacaine for dental blocks because it will last a good 6 to 8 hours. The second dental nerve block would be the inferior alveolar nerve block, and that will numb all your lower molars and your premolars, including the incisor. So how do I do this nerve block? Go ahead and try to feel with your finger or thumb. Right here is your coronoid notch. It's right behind that last tooth. Right behind it, there is like a little groove there, and that is your coronoid notch. That's where you're going to inject, right in that notch. You just inject directly 2 to 3 ml. And this is a picture right here of the patient's mouth. This is the coronoid notch, and you inject directly into the coronoid notch. Okay, now we're going to go ahead and do our digital blocks. I'm going to start with the traditional method first. So the traditional method is our web space block. Our web space block is when you inject directly into the web space. It is least painful method. You insert the needle perpendicular to the digit, and it's just distal to the MP joint. You slowly inject dorsally towards the volar aspect. Please don't pierce the volar aspect of the web space. And you're going to go ahead and repeat and do the same thing on the other web space of that same digit. And that will go ahead and cause anesthesia of the whole finger. If it's a toe, you do the exact same way. So there's another picture right here. Needle is perpendicular to the digit, distal to your MP joint. You inject dorsally to volary. Don't volar. I don't know what that word is, but volar. Don't pierce your volar aspect, and go ahead and inject the other web space on that same digit. So that is the traditional method that most of us are used to. I'm going to go ahead and give you another method that I like a lot because it is only one injection. So it's called the transcecal block. And with the transcecal block, the other name for it is your flexor tendon sheath digital block. the disadvantage of this nerve block, it's painful because you're injecting into the flexor tendon sheath. However, you only need to do one injection. So that's why I like it. How do you find your flexor tendon sheath? Well, first, you find your distal palmar crease right here. And then you're going to go ahead and palpate just distally to the palmar crease. Go ahead and palpate your flexor tendon sheaths. If you can't find it, just wiggle your finger. You'll feel it. And you are going to inject 45-degree angle. So it's not perpendicular, it's a 45-degree angle, just distal to the distal palmar crease. When you inject, the fluid has to move freely into the sheath. If you are getting any resistance during this injection, just pull the needle about a couple of millimeters and try and inject again. You should be freely moving into the flexor tendon sheath. This method is as effective as a ring block, and therefore I'm not going to be talking about ring blocks in this lecture because I don't do ring blocks. I don't see a reason why I need to inject somebody on 3 different sides of their finger to achieve, or 4 sides just to achieve the same thing that you can achieve with one single injection. So that is the transthecal block. The modified transthecal block is the one that I do most of the time. It's very simple. This one is perpendicular injection, not a 45 degrees. So it's 90 degree at the metacarpal crease right here. You hit the bone, you go all the way to the bone at the metacarpal crease. And once you hit the bone, just withdraw the needle, maybe about a millimeter or 2. And then you go ahead and slowly inject. And you use your non-dominant hand to apply pressure just proximal to where you're injecting. And that will force the fluid to go distally instead of it moving proximally. Just like this picture right here. Needle is inserted at a 90-degree angle at the metacarpal crease. Hit the bone, move back a millimeter or 2, inject very slowly, and press firmly with your non-dominant hand, just proximal to the area where you're injecting, so you can force the fluid to go distally. The last type of block that I will be talking about in terms of digital blocks is called the wing block. And this method is only used if you only need to work on the distal part of your digit. So nail injury, nail bed injuries, fingertip avulsions, something like that. In this method, you are going to hold the needle like in this picture, perpendicular to the long axis of the digit. And you're going to hold it at a 45-degree angle. Where you're going to inject is you're going to draw an imaginary line from linear extension of the lateral and the proximal nail fold. If they meet at a point 3 millimeter proximal to that point, that's where you're going to inject. So there's lateral and proximal nail fold. If they were to meet at a point, that point 3 millimeter proximal to that imaginary point, that's where you're going to inject. When you inject, you're going to inject first along the proximal nail fold, so in this area right here. And then you're going to reposition the needle without withdrawing the needle, and you're going to inject into the lateral nail fold. So you can get this whole side. Proximal first, move the needle, and inject laterally. You're going to repeat the exact same on the other side, so you can get the whole distal digit now. And that was the last block I had for today. I hope you enjoyed this video lecture. If you have any questions or comments, just send me an email. I will answer as soon as I can. And thank you very much for listening today.